Hello, I'm Dr. Gordon Johnson, and I'm going to present a short case today as part of our POCUS Pearls for the Society of Hospital Medicine Special Interest Group for point-of-care ultrasound. The title is, Where's the Fluid? This is a 58-year-old male that presented to our hospital with a history of chronic kidney disease and had subacute shortness of breath and weakness. Slightly hypotensive with a blood pressure of 90/60, a heart rate of 64, respiratory rate of 18. He was afebrile. He appeared chronically ill and weak. His heart showed faint tones, but a regular rate and rhythm. His lungs showed some rales at the bases and decreased breath sounds at the bases. He also had 2+ pitting edema in the lower extremity. Here is his parasternal long axis view of the heart. Take a look at this and see if you can see any abnormalities present. So what I want to point out first is he's got enlargement of the right ventricle here relative to the aorta, also enlargement of the left atrium. He has a poor ejection fraction, probably severely reduced, with a very abnormal EPSS, where the anterior mitral valve leaflet does not come within 1 centimeter or less of the septum here. Here's the centimeter markings on the side. You can also see fluid collections behind the heart here, and a bright line and another fluid collection back here, and fluid up in this area. When we moved the probe down to the lower left side, we saw that there is a left pleural effusion with associated consolidation of the left lower lung. Here's the diaphragm, and he even had a little bit of ascites present as well. So this case is a good example of how to differentiate pericardial and pleural fluid in the parasternal long axis view. And here you can see the pericardial fluid usually bird beaks up like this, just behind the heart with the pericardium behind it, and up and around this round structure, which is the descending aorta. A pleural fluid collection, or left pleural effusion, is seen more in a rhinoceros horn type appearance in this area. Patient also had a low ejection fraction and had uremia as the cause of the findings, as well as systolic heart failure.